Hi, hello to all of you. I am Dr. Harshal Rajakar. I am a liver transplant surgeon and a liver surgery specialist. Now, today I am going to talk to you or tell you about what is liver cirrhosis and why it needs a transplant. Liver cirrhosis is permanent scarring of the liver. Now, wherever there is an injury in the body, it leads to the injury generally heals, and that healing is replaced by a scar. The liver heals by two methods. So, when there is a sudden injury, like a surgery or like trauma or something like hepatitis, जो पानी में से होता है, like waterborne diseases and things like that. So that sudden injury will usually heal by without scarring. So the liver recovers normally, and the liver has a tremendous capacity to regenerate. But injury that happens gradually over a period of time is gradually injury and gradually healing. So this healing leads to replacement by scar tissue or inflammation and scarring. Now, when there is scar, the scar always has an effect. Now, this scar leads to one, the scar does not function, and two, all scars which over a period of time tend to contract. So, this is what generally. So, like let's take fatty liver. So, when there is initial fat, then there will be small scars on the surface, and then eventually the scar will tend to pucker and contract. So, then the surface becomes irregular. So on any ultrasound or CT scan or MRI or any other method of testing, if we see that the surface is irregular, then we can say that this is liver cirrhosis. Now what happens after this? After this, it depends on whether the liver function is enough to meet the needs of the body. If the liver is enough to meet if the liver function is enough to meet the requirements of the body, then we say that this is cirrhosis, but it is well compensated. Then how do we know that it is well compensated? Then there is no jaundice. That means the bilirubin level is normal. The albumin, which is a protein made by only the liver, is normal. The INR is a marker of the clotting, which is also only done by the liver, is also normal. Kidney function is normal, there is no water in the abdomen, there is no swelling. Besides the function of the liver, the detoxifying function means that the brain function and everything else is normal. Then when do we say that it is decompensated? So if there is a rise in the bilirubin, fall in the albumin, rise in the iron or the prothrombin time, and water in the abdomen, swelling in the feet, development of jaundice, and any other complication like the development of a cancer, infection in the water in the abdomen, or affection of kidney function, or affection of the brain function called as hepatic encephalopathy. This means that the liver function is decompensated. And in such a situation, we say that a transplant is always going to be needed, if not now, at least in the near future. All scar is permanent, it is irreversible, and scar will not go away. Because as the scar contracts, the liver function will tend to get affected further. It will always end up leading to permanent damage and permanent reduction in the liver function. Whenever the body has some injury or infection or periods of stress, this decompensation may be initially seen, and gradually the patient has decompensated liver cirrhosis, which is only cured by a liver transplant. It is cured by a liver transplant, not only controlled. All other methods are only controlled. For any further questions, I will keep you updating. For the moment, I think this should be enough. Thank you.